This is Val. I'm here today with Maya. We wanted to talk to you about some exercises that you can do at home for the first 2 weeks following TTA or TPLO surgery. Before we get started with the specifics, I'd like to review some general recommendations for the first 2 weeks. The goals of the first 2 weeks after surgery are to manage pain, limit the amount of swelling, increase flexibility of the stifle or knee joint, maintain flexibility of the hip and ankle joint, increase flexibility of the toes, decrease the amount of atrophy or muscle weakness, and improve use of the surgical limb at a slow walk. Here are the guidelines for initial home care. Number 1, there should be absolutely no running, jumping, playing, off-leash, or unsupervised activity for at least 12 weeks or until bone healing and implant stability are confirmed on radiographs by your surgeon. Number 2, always assist your dog getting in and out of a vehicle. Don't let your dog jump down or up into the car. Number 3, no stairs. If this is unavoidable, use a towel as a sling under the dog's abdomen to support 50% of your dog's weight and prevent the dog from slipping or falling. This is an example of how you might use a towel to help take some weight off of the dog's hind limbs or surgical side if you might need to go up or down a couple of stairs going in and out of the house. Make sure your dog is on a leash. Otherwise, block off stairs with a secure baby or pet gate. Number 4, keep your dog contained in a small room or a section of a room to restrict his or her activity. There should be secure footing in this area, such as carpet or non-slip mats or runners, as well as in other parts of your house where the dog may need to go. Number 5, other than walks for exercise, your dog should be outside on a short leash to use the bathroom only. Number 6, cryotherapy or ice packs. You can apply commercial gel cold packs or use bags of frozen peas or crushed ice to the inside and the outside of the operated knee for 15 to 20 minutes, 4 to 6 times a day to help reduce pain and post-op swelling. Put a thin damp cloth next to the skin, such as a clean dish towel or a t-shirt, and then cover the cold pack with a towel to hold it in place. Do this for at least the first 2 days, especially after walks. Before you start with range of motion exercises, it's sometimes helpful to start with gentle massage of the dog's thigh, being careful to avoid the incision area. So you can just stroke and relax the muscles of the hip and the thigh. This may help with any spasm or soreness in the muscle that your dog has. It helps to relax the whole leg before you start the range of motion exercises. When dogs are not bearing full weight, if they're injured or after surgery, they often don't fully press down on their toes and extend them. So you want to help keep the toes from becoming tight by moving them into extension. So I'm just going to put my hand on the bottom of Maya's foot and bring her toes into extension and then just hold them there. And you can relax and repeat that a few times. I'm going to support the knee with one hand gently underneath and one hand up at the dog's ankle or hock. You can gently bend the knee and the ankle up and then gently straighten. Just go slowly. If the dog pulls back, just relax and try again. I'm going to try to get as straight as you possibly can. just like that. So bending the knee as far as possible, holding at the ankle, and then straightening the ankle and the knee at the same time. As I'm guiding Maya's knee back, I'm holding and supporting her ankle but not pulling on it. So I'm guiding it back as I help straighten her knee. Sometimes it's easier to just go part of the way the first few times, so the dog gets used to the movement and relaxes a little bit. And then go more completely as the dog's muscles relax. And then finally, we're going to move into hip extension. Sometimes it helps to stroke or massage the dog's hip flexor muscle, which is the one that you're going to be trying to extend. I'm going to bring the dog's hip back as far as possible and then hold it there. When I feel her relax, I might try to go back a little bit further. Have your dog stand in front of you with feet aligned under hips. You're going to shift your dog's weight over onto the left surgical side and then back over. And you can do this about 10 times. So what you're looking for is that the pads of the surgical side begin to spread and flatten, just like the other side. So one way to get your dog to shift weight to the surgical side is to hold up the opposite front leg. So I'm going to hold it up for a couple seconds and then I'm going to put it down. I'm going to hold it up again for a couple seconds. If your dog is holding its surgical side up off of the ground, you should notice that when you pull up or hold up the opposite front limb, that the dog puts the surgical side down. So look for that. They may then start to pull it up after a couple of seconds. You want to let the front limb go down and then try it again. Our final exercise is a cookie stretch. You're going to hold a cookie in your hand and encourage the dog to look up and down. When they're looking up, they're shifting their weight back to their back legs. So up and down with the emphasis on up, and then side to side with the emphasis on movement, particularly over to the surgical side. Treat. You can use treats to lure your dog into position or to reward them for good performance. When walking, be sure to go slowly enough so your dog consistently puts the operated side down. Thanks for spending this time with us. I hope your dog has a successful recovery.
So let's go, skin soft. I wanna stand where I want.